Money!
What Your Bank Doesn't Tell You, a podcast by UMushroom.
Hello, everybody, and welcome to our podcast, What Your Bank Doesn't Tell You. Today, we have a very exciting topic, a topic which is relevant to all of us, and we are speaking about healthy living. I'm very excited to have a guest today with me, and it's Alyssa Cornuz from Robeco. Hi, Alyssa.
Hi, thank you for having me.
So allow me to say a few words about you to introduce you properly to our audience. And you have joined Robeco about 3 years ago. You're co-portfolio manager of the Sustainable Healthy Living Strategy. And before joining Robeco, you have also worked for other very prestigious names like UBS, Nordea, Credit Suisse. And you have always been an equity analyst or sustainable analyst. And you're bringing all your expertise, what you have collected over the years, to this strategy you're managing. You're also holding a master in finance of the University of Lausanne, and you did the CFA. So for those who don't know Robeco, and I believe most of you might know the name already, Robeco is a Dutch asset manager, started almost 100 years ago. And Robeco has also a very strong presence here in Switzerland because of various acquisitions in the past. And Robeco is also a name which is very much focusing on sustainable investing and is also a very credible name when it comes to ESG and sustainable investing overall. So Alyssa, coming to our topic of healthy living, you have been working and researching in this area for a very long time. And I believe we are all spending kind of quite decent money when it comes to health and healthy living. So tell me, according to your experience and your research, what is really worth spending on health and what not?
It's a very complex topic, and indeed, health can be expensive. If we look at it at the aggregate level, we know that OECD countries spend on average 9% of their GDP on healthcare expenses. In some countries like the US, it can be much higher. So in the US, 17% of GDP is actually spent on healthcare expenses. That's quite meaningful. What we know is that the population is aging, and the prevalence of obesity and chronic disease is also rising. So that puts pressure on healthcare budgets, but also more broadly government budgets and society as a whole, because we have to bear the cost, but we also have to bear kind of the drag on productivity from people who are chronically sick. And what we also have looked at for the healthy living strategy is really what is the difference between what makes us healthy and what we spend on being healthy. And we found out that there is a big discrepancy. So some studies have tried to assess and quantify really what are the main factors impacting our health. And they found that healthy behaviors, so eating healthy, moving your body, etc., were actually 50% of the drivers of your health, whereas access to care and just the genetics you were born with only account for 30%. Now, if we look at what we spend on healthcare, 90% actually goes into medical services. So there is really this big discrepancy between what will drive our health, what makes us healthy, and where we spend the money.
Mm-hmm. That's very interesting. And you mentioned already many interesting facts. So let me get back one step. So you said basically that prevention and having a healthy lifestyle overall with good food, with exercise, is basically cheaper and has a big impact on health in respect to fixing issues with medication, which is much more expensive. So let me be a bit provocative. And you also said that the US, their people are spending much more on healthcare. Can we then say that the US is a country where people take less care about prevention and they rely very much on medication?
I think we need to nuance that a bit. So, not only in the US, but let's say in developed markets, chronic disease, and I mean non-communicable disease or chronic disease, are the leading cause of disability and death. And 1/3 of adults are actually reporting living with a chronic disease. So that's really, really meaningful. Now, what we know is that you can prevent most of these diseases. That's why we also call them lifestyle disease, right? So people who actually do not smoke, limit their alcohol intake, are trying to eat healthy, or exercising at a moderate pace, actually are less likely to have an early death from this lifestyle disease. And actually, we know that if you are obese or overweight, you have a higher likelihood of getting cardiovascular disease, diabetes, but also different types of cancers. Yet, 60% of adults are actually overweight or obese. And then in the US that you mentioned, that even goes to a proportion that is higher than 70%. So maybe going back to your question, I guess in the case of obesity, there is a really good argument of preventative behaviors and taking a pill can really coexist together because healthy behaviors have a big role to play in obesity prevention, for example. But once a patient is actually obese, telling them to just work out or eat healthier, it doesn't work. And I mean, we see it, right? The prevalence of obesity has tripled since the 70s. If you could just tell obese patients to work out a bit more, I think we would have solved the obesity epidemic for a long time. So in the US, typically obesity is recognized as a disease that needs multiple treatments. So here, typically using weight loss drugs in combination with healthy behaviors can be a solution where really you can combine both prevention and healthy habits, but also you can take a drug that will actually help you kind of speed that process. Mm-hmm. So I think probably the answer is more kind of in the gray area. Obviously, you can adopt these healthy behaviors to prevent the use of medication, but maybe once you have reached a certain threshold of disease, then you also need to combine them with prescription drugs.
That's very interesting. And recently I also read a study, and basically in this study it was written that in the US it's much more difficult to actually live a healthy lifestyle because you have much more pollution. It's more difficult to get the healthy food, etc. And also that in the US medication is much more expensive than here in Europe.
Yes. So I guess there are two parts to your comment. First, so there are challenges in terms of adopting healthy behaviors at an individual level. Obviously, healthy food might not be accessible or it might not be affordable. And also, I think indulgent products are heavily advertised, right? Yeah. If you watch TV or if you just, you're in your car and you see advertisement for fast food chains, or maybe they are very conveniently located. So I would say the non-healthy food choices are very abundant, and it takes a proactive effort and sometimes also a higher cost to actually adopt healthier behaviors. So that's a major hurdle at really the individual person level. But I think we have seen rising awareness of what's good for your body, and more people really taking ownership and responsibility of doing the right choices for the health. So eating healthier, exercising more, etc. And definitely the pandemic has accelerated that change because it really highlighted the vulnerability of people that had chronic disease or that were obese or overweight. And I think some people really realize, this is actually really important for me. It's not only a cosmetic problem. Really, I really need to take care of my health because down the line, it's going to help me. And then in terms of the cost of drugs in the US, I think there is often a lot of debate around the cost of drugs. But if you actually look at where the money goes in terms of the healthcare spending, I think prescription drugs are just 9% or 10% of the overall spend. The bulk of it is really in hospitals, in primary care, physician offices. So a lot of attention goes there, but that's actually not where most of the spending goes. And maybe we can touch upon it, later in the discussion. But also, developing a drug is very lengthy and costly. And then in the rest of the healthcare system, there are a lot of inefficiencies also relative to the administrative burden. So I think the real costs that are maybe unnecessary might not be in the drug development, so to say.
Okay, that's a very interesting fact, and maybe to go one step back again, because you're mentioning so many interesting facts, and I'm trying to follow them very carefully. So basically, in respect to chronic diseases, and I understood in the US there are some additional challenges. And by the way, even in my case, I realize it as well. If I go into indulgent food, then it's like a bit an addiction. So if I'm into my chocolate taste, then it's very difficult to stop again. So I imagine if temptation is even bigger, which might be the case in the US, then it's very difficult to have actually a diet which is healthy. But getting back to the chronic diseases, what we are experiencing these days. So I mean, if we have these diseases, and it's kind of just a fact because of our lifestyles, where do we go? Who is financing these costs, and what's the future of our health system?
Yeah, so I think as we mentioned, as the population is aging, and I think discussions around healthy aging and longevity are taking a more important place in our society, really. I think it's important to just go back to what does it mean to live a healthy lifestyle, because it really doesn't have to be complicated. It's not about, very sophisticated diets or hours and hours of exercise. If you go back to what the World Health Organization is saying, they have, I think, about 10 recommendations, but maybe, the top 4 are just eat healthy, exercise, drink in very moderate amounts, and do not smoke or vape. It's very simple. I think it's very simple. It's very easy to implement this. And what they mean by eating healthy, for example, is just reducing the amount of salt, sugar, saturated fats that we eat, and prioritizing eating fruits, vegetables, whole grains, nuts. The same goes with exercising. I mean, a week is 168 hours. They recommend to exercise for 5 hours. So that leaves you with a lot of time, right, to do everything else you want to do in your week. So I think these recommendations are quite easy to implement. And I'm the first one to recognize that when you walk into the supermarket, it's very hard to actually stop at the vegetables and not go to the chocolate and confectioneries. But really, in terms of who you can implement this, it's actually pretty straightforward. And if, as a society, we all make small changes, it can have a huge impact, really, on our overall health. Because, as I said before, if 60% of adults are overweight or obese, just small changes already making a big impact on the productivity of our society and healthcare costs in general.
Mm-hmm. Mm-hmm. But basically, you're saying it all comes down to self-responsibility in the end.
I think there is also a part of government and corporate responsibility, for sure. So we have seen governments in recent years trying to tax sugar, for example, or try to issue new guidelines that were maybe more comprehensive, also taking into account not only the calories of the food, but also the processing, so the discussion around ultra-processed food. So I think there has been some government intervention. And then it's also our responsibility as consumers, shareholders, to talk with companies or engage with companies that produce and distribute food, and make sure they also try to reduce the amount of unhealthy food that is in our food ecosystem. And when you look at companies that are active in the space, actually a lot of them already have targets in place to reduce, let's say, the salt content of the products, or to increase the percentage of their food portfolio that has very high health star rating, for example. So there are different things in place, but it's going to take time to change, I think, at the government and corporate level. So while we wait for this, I guess, big changes, and while we encourage them, it's also important that we take responsibility at the individual level. Yes.
Absolutely. And in this respect, did you see this movie on Netflix about the blue zones and the secrets or the tips of basically these people, how they get very old?
I have actually not seen it. So.
And it's very interesting. Basically, they are repeating or saying the same what you were mentioning before. So they move a lot. They usually live in very in a hilly environment, so they need to walk up and down all the time. They exercise in this respect naturally. They usually eat very fresh food. They don't drink a lot. In some cases, they even smoke, but they don't smoke a lot. And very important, they don't experience stress. I believe this is a very important factor, which is kind of difficult in our lives, not to have any stress, or at least less stress. One point you mentioned before as well is the responsibility of the shareholder. And I'm very curious, you as a portfolio manager, how do you take on this responsibility?
So what we do at Robeco, and I was talking about food manufacturers before, so maybe we can stay with that example, is that when we approach a company and we want to decide if it fits our view of what's healthy, we are going to mix internal expertise and also external data. So there are many data providers or organizations that look into the healthiness of different portfolios. For example, the Access to Nutrition Index is a really good example. So we are going to blend this data and our internal expertise and try to assess also the company's targets in terms of improving the healthiness of the portfolio. It might not sound like it, but that's actually a pretty strict approach. And when I think about most food manufacturers that are listed globally, that are investable for large funds, large strategies as ours, I can actually only invest in a handful of companies. Probably I can even count them on my fingers, maybe just one hand, when it comes to purely food manufacturing. Because so far, there are very few companies that have a portfolio that is healthy enough on an aggregate level. Often you have big food manufacturers that are active in many different categories and have exposure to snacking or very indulgent products. So I think we are quite strict in that sense in terms of which companies we can invest in. And what we also try to do is really engage with these companies. A couple of months ago, I was meeting one of our investee company, and we had a very long discussion on reformulating their products to meet updated health guidelines from a country they are active in, and how they had managed for even products that might be on the threshold of being considered indulgent to actually make them much more healthy. So it's a constant, I think, dialogue that we have with our companies really on the topic.
And I think this is a very important point, that more asset managers, they also kind of are activist investors, yes, almost in a sense, really forcing companies to become healthier or to produce healthier products for their consumers. And I'm also wondering, I mean, I think you take your responsibility very seriously. And how does it compare maybe to your competitors? Are they doing something similar, or where do you see the differences between your strategy and the strategy of other asset managers?
Yeah, so I think the main difference, if we compare within strategies that have sustainable goals, is that we really have that holistic approach on healthy living, and not only healthcare. There are a lot of pure play healthcare strategies and a couple of strategies that just focus on the food systems. So we really focus holistically on all the factors that make us and keep us healthy. And instead of investing just in healthcare or just maybe in food, we really cover all these factors, from healthy nutrition to good hygiene to physical activity and to efficient healthcare. So really our USP is trying to capture all these factors and not maybe one aspect of it.
So it's kind of a bit a mix between lifestyle and really almost into biotech a bit, if I get you correctly.
Not only biotech, because when we talk about efficient healthcare system or healthcare in general, there are many sub-industries within that. So we are going to invest in the health insurance companies, in the pharmacies, naturally in the pharma companies, but also in companies that just do research outsourcing, for example, to speed up clinical trials, etc. So it's really a broad ecosystem. And as I mentioned before, we think really it totally coexist with prevention. We really want to tackle kind of the two sides of the coin.
Earlier in the discussion, you also mentioned the challenge of the drug development. How do you take care of this aspect in your strategy then?
I think there is, with rising healthcare costs, there is a lot of public scrutiny on the efficiency of healthcare spending. So the price of prescription drugs is something that is talked about quite a lot in the media. But what most people don't know is that it takes really a lot of time to develop a new drug, on average between 8 to 10 years. And it costs between 1 and 2 billion US dollars. So obviously that's on average. And also the chances of success are really low. So only 1 out of 10 candidates actually make it to the market with a regulatory approval. So when you start developing a drug, really the odds are not really on your side, I guess we could say. So that really means these companies need also to earn a certain return on the R&D they have done and the risk they have taken. And for one drug that actually comes to the market, there are a few others in their pipeline that just didn't make it. So that's reflected in the price of prescription drugs. And then obviously the healthcare system is very complex. So the headline price that you hear about in the media is not necessarily the price that will be paid in the end by the patient or by the insurance. There are complex negotiation rounds that involve different stakeholders in the system. So it's, as I mentioned before, it's a topic that is talked about a lot, but actually not responsible for most of the, for a big chunk, let's say, of the healthcare spending overall. And that can be justified by all the research and the risks that are taken actually by pharma companies.
I personally believe, or from my personal experience, so most of the people, they read many facts about the healthcare system in the newspapers, or you watch the news in the TV and you hear these facts, but it's very difficult to judge what is really true in the end and what not, and what has an impact and what not. And this is one reason, in addition, I believe, to invest via a strategy, via a mutual fund into this very complex topic. So maybe if you could just summarize again, what are the USPs of your strategy and what makes you really different?
Absolutely. So the strategy is managed by my colleague David and myself. And David has a PhD in immunology. He has spent some time doing medical research earlier in his career. So he has a really long track record of both scientific and equity research. And as you mentioned before, my background is more in equity research. We are both passionate about all aspects of health. And what we're trying to do with that strategy is really address the United Nations Sustainable Development Goal number 3, which targets the reduction of non-communicable disease through treatment and prevention. So relative to other strategies that focus only on healthcare, we want to really focus on both the treatment and the prevention and focus holistically on all the factors that are going to make us healthy and keep us healthy. So that's why we invest across healthy nutrition, good hygiene, physical activity, and efficient healthcare and effective treatments.
Yeah, you're definitely a very credible example, because you mentioned before when we met earlier that you have a very healthy lifestyle, that you do plenty of sports, you do yoga, etc. Maybe you can tell us your very personal health hack.
Yeah, definitely. So I think also earlier in the discussion, you mentioned the impact of stress on our health. And that's something that there is no magic wand or magic pill to make it go away. And definitely sports is the way I try to manage it. So that would be kind of my magic trick, is really to exercise, get also the mental benefits from exercising, not only the physical ones.
Kind of also meditation in a way, I assume.
Yes, exactly. Yeah. So running, yoga, meditation. I often joke that I'm a different human being when I actually exercise and when I don't.
I signed to that, by the way.
So that probably comes on top of before we mentioned the World Health Organization guidelines in terms of healthy behaviors. And one thing that was not directly mentioned, but that really counts, is just also the mental health benefits from exercising and eating healthy. I really truly believe that you feel better also mentally if you do that.
Yeah, I also signed to that. So you know that our name is UMushroom. We are called UMushroom, and it's not a very typical financial name. And most of our viewers and listeners know why we are called UMushroom. It's because of the connectivity, and that we are highly convinced that if we share information also about finance, that we are all in a better position. And also the mushrooms, they are very fascinating because they don't have a king, they don't have a boss. They all contribute to this organism and help to grow it, and to start symbiosis with other creatures, etc., and to have a very sustainable living. So in respect to healthcare, also mushrooms, it's a topic which is coming up, and you can read a lot about microdosing. Do you have an opinion about that, just in honor of our name?
So currently we don't directly invest in companies that would be active in microdosing, but I think the space is interesting, especially regarding to the benefits for PTSD, depression, or anxiety generally. I think there are some trials that are currently running. I read one or two of them. I think what we have to take into account is also the risk and the need for guidelines. I think it's a really promising field, and I would love to see actually some trials and applications going through. What we need to be careful with, I guess, is really the lack of standardization. How do you make sure that the dosing is always going to be the same, that your patient doesn't want to self-medicate a bit at home, maybe? So I guess the need for guidelines to be in place, but definitely in terms of improving mental health and treating specific condition, I think it's really it's a promising area, and I would love that in 10 years if we can have a couple of companies that are actually active in this in the fund. I think it would also fit.
So it could be an opportunity. We also talked about many issues in the healthcare system. So where do you see the opportunities in the coming years?
Yeah, so I mentioned earlier, I think really there is at society level this rising awareness of what's good for your body, what's good for your health, and really taking ownership of your own health by preventative measures and healthy behaviors. So I think what we already see, and I think what's going to continue in the next years, is really the enablers of these healthy behaviors. So that can be food manufacturers or retailers that are offering products that are healthy and nutritious and are responding to new needs of consumers. We see that they are met with a lot of success. So I think for me, the main opportunities really are these new categories that are going to be created typically in the food in the food space, which will see high growth because they are actually answering to consumer needs for healthy products.
I see there are plenty of opportunities, and we are definitely following your strategy very closely. To all of you, if you have any question also to Alyssa and this very exciting topic about healthy living, don't hesitate and write us to hello@UMushroom. We are very happy to take your questions. You can also comment on the various platforms where this podcast is available. With this, I would like to thank you a lot, Alyssa. It was a pleasure having you here today. And to all of you, I wish you a very good time and see you soon. Thank you.
Thank you.
Money!
What Your Bank Doesn't Tell You, a podcast by UMushroom.